kia ora koutou, nā mai haere mai, ko Barry Milner ho. He manataki ki Campus Research Centre, ki Waipapa Tamara Rao. So hi everyone, welcome. I'm Barry Milner from the University of Auckland at the Campus Research Centre. I'm also on the executive committee of the Virtual Health Information Network, who are putting on these webinars. This is the second one that we've run. And delighted to welcome Andrew Webber from the Social Wellbeing Agency here along with us. He's a chief economist there. He's been there for about 18 months. And prior to that, he was the chief economist at the Ministry of Education. The Social Wellbeing Agency, for those people who do not know, it's a small-ish government agency that's been around in various forms over the past 10 years, starting off as the Social Investment Unit, then the Social Investment Agency, and now the Social Wellbeing Agency. It does a lot of cross-sectoral work, providing evidence and advice to government agencies, doing a lot of its work in the integrated data infrastructure, which is what Andrew's going to present on today. And what he's going to present on is about aspects of children who went through alternative education and teen parent units, and the impact that that has had in terms of their outcomes. This is based on a series of reports that have come out of the Social Wellbeing Agency recently, on the one hand, the alternative education units and the teen parent units as well. So I'll pass now over to Andrew for the webinar.
Yeah, thank you, Barry, and kia ora koutou. I think Barry kind of summarised usefully the kind of context to this work. What I'm going to kind of be covering today is summarising the kind of key takeaways and insights coming out of 4 recently published reports. A project, 3 of them relating to a project that we jointly did with the Education Review Office focused on alternative education, and then a little bit of extra stuff on a bit of a bonus on looking at teen parent units. So this is a slightly tricky kind of presentation to put together, because the way I see it, there are kind of 4 key audiences here, that we've got potentially audiences who are kind of focused on the education implications of some of our work, and then other people who are interested more in the general kind of cross-sectoral implications. And so that's the kind of vertical axis, and on the horizontal axis, you've got the kind of, I suppose, wonks versus nerds dimension of people who are interested in more the policy applications versus people who are more interested in the kind of methods and broadly speaking, as I mentioned, there are kind of 4 core audiences here, and so I suppose while I'm talking, if you're able to just kind of mentally place where you are on this matrix, and then I've tried to kind of flag slides that might appeal to particular audiences as we go through. I should also say there are way too many slides here, so I'm going to try and skim over lightly and focus on the things that are most of interest. I think we can either revisit some of the other slides that I skim over in the Q&A if people are interested in that, or I can make these slides available afterwards so you can have a look. As Barry mentioned, this work was done using the integrated data infrastructure, which is essentially a large government database of people with a whole bunch of kind of interactions or data about people's lives, particularly interactions with government agencies. So we're able to see in a de-anonymized way people's interactions with the health sector lined up with their interactions with the education sector, justice sector, what they said in the census, that sort of thing. And so kicking off with the kind of first project focused on alternative education. Alternative education is basically a kind of, it is what it sounds like. It's an alternative to mainstream schooling, mainstream school education. So it's an educational support program for secondary age students. And you can see there in the graph to the right, predominantly people enter alt-ed when they're between 14 and 15, and it's aimed at people who are at risk of disengaging or have already disengaged from the schooling system. And so essentially there are concerns there around the student is just not going to attend school anymore. School is not the right place for them. And essentially it aims to provide education and support in an environment that doesn't look like mainstream schools. So it's structured more flexibly, and the intention is to support learners back in to transition either back into school or further education or training or employment. And the work that we did with the Education Review Office, they did a whole bunch of data collection, kind of qualitative collections, quantitative collections, and then we said we will support that work through 3 specific things that we'll do in the IDI. Firstly, we'll describe the characteristics, the context, and the prior experiences of the people who enter ALTED. Secondly, we'll attempt to find a comparison group of people who look like the participants in all of those ways, but don't go into ALTED. And then we'll look at the later life outcomes of both the ALTED folks and the comparison group. So the kind of what are the key takeaways from that first bit of work looking at the characteristics and backgrounds? The first is basically the biggest difference we saw, or the biggest kind of predictor, I suppose, between participants and non-participants was the extent to which they were exposed to exclusionary discipline prior to going into ALTED. So that seems to be the kind of most prevalent pathway into alternative education, which is stand downs and suspensions, basically where the student is asked, because of some aspect of their behavior, they're formally asked to not attend school for a certain amount of time. And so you can see there in that graph, basically the kind of green teal is ALTED, the gray is non-ALTED, hugely lopsided. So ALTED participants are 22 times more likely to have at least one suspension prior to enrolling in ALTED. So that's kind of within the education system, but then we also saw lots of signals kind of outside of the education system, the ways in which that kind of characterize many of the kind of experiences and needs of these participants. So this is something from the kind of disability sector. We found, for example, ALTED participants are far more likely to have kind of diagnostic evidence that they have ADHD and intellectual disability, and they're slightly more likely to be flagged as disabled using census questions. We think that is kind of understated by a reasonable amount, because in the ERA arm of the work, this is something that kind of repeatedly came up from providers, from whānau, from the students themselves, saying, hey, I've got these needs, but I have not been diagnosed. I am struggling to get support through the kind of health system, through the disability system. And so we're not going to be picking up those sorts of people where that's just kind of going under the radar. Looking at mental health, that was another kind of big one where we saw substantial evidence that participants both were far more likely to have evidence of serious mental health needs themselves prior to participating in ALTED, but both their parents were also more likely to have evidence of mental health needs. And then looking at a different sector, so that's kind of looking at health, looking at the justice sector, we also found substantial evidence that in particular, participants were more likely to have parents who were had experiences with the justice system, especially things like custodial sentences. And that was true of both their mothers and their fathers. And we also found a reasonable amount of evidence. So a pathway not super common, but certainly very lopsided in favor of alt-ed was a pathway in the youth justice system. So the students themselves were sometimes involved in the justice system prior to coming into alt-ed. And so that's kind of all to say, putting that together, people who enter alt-ed, the kind of picture hopefully I'm building up for you is that they've had quite disruptive, often traumatic lives, that they have a lot of needs, and this is kind of resonant with what providers told ERO and what students themselves told ERO. They have a lot of unmet needs when they first enter alt-ed, but also hopefully the picture I'm painting for you is the government knows who these people are, so they have a lot of interaction with various parts of the government sector, and so there's a kind of clear question then that raises as to can we better support these people before they disengage from the education system. And so kind of moving on to the kind of method of what we're doing, basically what we do is we construct a data set of people's lives according to those sorts of characteristics that I've just shown you. And then we run a statistical model that predicts, based on those things, who's likely to end up in alt-ed. And then we use those models' predictions to match participants to people who look like those participants. And we kind of make sure that they do, in fact, look kind of the same. But the key question I kind of want to flag here is, so we check to see whether they look the same based on the things that we can detect in their lives, but by definition we can't check to see whether they're the same in things that we can't measure or can't detect. And so if it and so a lot of what we're talking about kind of hinges on this question of, have we picked the right comparison group? Oh, sorry, and then we follow the comparison group and alt-ed participants through later life outcomes and take the difference of those to look at how alt-ed might be supporting people. So as I said, this is kind of the crucial question: did we identify a good comparison group? And possibly typical for kind of government analysts, we were a bit wishy-washy on that question. So if you read the reports, basically we try and present a whole bunch of kind of evidence, pro and con, this question, and our hope is that people can kind of make up their own minds as to whether they feel that this is a good comparison group. And so I'll just run through a couple of those kind of pieces of evidence now quickly. The first of that is that our statistical model seems to do pretty well in predicting who ends up in alt-ed. So we took that as kind of potential evidence that we're capturing the main things that matter to, or at least the main things that are correlated with moving into alt-ed. And so we're potentially not missing out anything like super major there. There were other things that we looked at where we ran kind of some models that excluded some factors and some models that included those factors, just to see like if we exclude certain things, does it make a difference? And found, broadly speaking, we end up with the same group of people and the implied kind of results are about the same. So that's kind of evidence number one. The second thing is, like, this is kind of just standard diagnostics for a kind of matching model like this. Basically, when we look at all of these characteristics, we looked at 86 different variables. All of those were kind of balanced across our participants and our comparison group. And also, we had a lot of common support here. So this is basically the distribution of predicted probability that the model gives us for the participants. That's the kind of green curve, and then the comparison group who we match them to, which is the red curve, which you can't see because it totally overlaps the green curve. There are also kind of in here conceptual reasons to think that there may not be selection, strong selection effects. So there may be a whole bunch of people who really do are really like participants, but just simply weren't able to receive alternative education. The first of those is that we know that alternative education has capacity constraints. So it's really common for schools to have wait lists for alt-ed. And ERO heard that 64% of school leaders told ERO that they report not having enough places in their school, and many schools just have given up using or referring to alt-ed at all because they say there's simply not enough places. Secondly, the allocation has to be local, but capacity isn't necessarily determined super locally. So to give you one example, Wellington City, where I am at the moment, the nearest alt-ed provider to Wellington is Nainai College in Lower Hutt, so a kind of decent trek away, not an impossible commute, but it is a decent distance from all of the local kind of schools here. Whereas if you live in Masterton, there are 3 different alt-ed providers kind of in that relatively small city. So there's a question there about basically there's a conceptual reason to think that depending on where you live, you might have different differential levels of access to alt-ed. And also, we know that some schools don't like alt-ed. They don't think it works, and they try not to use it. And so that might be another reason why some people who might be otherwise eligible for alt-ed don't end up receiving it. And then on, this is a kind of evidence that could go either way. So one thing we did is basically we ran our model, we generated our kind of our ones and zeros here, our kind of participants in their matched comparisons. And then we ran our model again just on those people. So we got rid of everyone else in the population and we just said, okay, between the participants and their matched comparisons, can we run a model that distinguishes between those 2 groups of people? And what we found was the predictive power of those models were very, very low. However, for some of them, when we ran a kind of placebo treatment where basically we randomly allocated treatment to randomly across those groups, we kind of got these numbers here. And so our model did perform, was a bit better at predicting who received alt-ed relative to that kind of, if it was truly random, if it was a randomized control trial. And so you might consider that as kind of the glass half full, like we were able to do a good job here. These AUCs are relatively low by standard, by most standards. Or you could say the glass is half empty. These are not random. Like we can, to some extent, distinguish participants from non-participants. And then some other kind of more negative reasons as to why we might not have done a good job. On the left-hand side, there were clearly things that we can't measure in the data, and conceptual reasons to think that the participants in the comparison group might be different on those things. And then on the right-hand side, the referral decision is mainly made by schools themselves, and there's not a very clear eligibility criteria. So the basically in total, the crucial eligibility criteria is, are you at risk of or already disengaged from school? And so it's up to schools as to define that however they like. And so you could interpret that as either in favor of our comparison group being good, in the sense that if that decision is kind of made idiosyncratically or quasi-randomly, at the margin at least, maybe we did a good job. Whereas if schools are kind of taking into account in that decision factors that we can't see in the IDI, then we're potentially going to do a bad job there. And there's also some evidence that came out of the ERO side of the evaluation that sometimes where people are involved in the youth justice system, which isn't often, but it is sometimes, the youth justice system mandates referral or enrollment in alt-ed. And so that might be a cause for kind of differential levels in need, I suppose. And so getting to the kind of last phase of our analysis here, what actually ends up happening to those learners. So there's a whole bunch of analysis on this in the report that you can kind of have a read, but I'll just skim over a couple of them. The first is this is looking at kind of educational outcomes. One thing we can say for sure is that the people who are participants in ALTED have much lower participation in further education, and most of that and end up with lower qualifications. And most of the reason for that is they don't go back to school, whereas the people in the comparison group, lots of them leave school early, but some of them stay on at least. So you can see in the comparison group, less than half of them receive NCA level 1, but that's substantially kind of better than people in the alternative education group. People who are participants in alternative education initially are more likely to enroll in tertiary education, but that drops off quite rapidly. And so there's something in there around potentially, is there something we could do to better support these students when they move on to their kind of next activity? And in many cases, that's tertiary education. So can we support them in the tertiary education sector? And then this is looking at a kind of smattering of other sorts of outcomes. So on the left-hand side here, looking at total income, and here we've got the kind of green group is participants. You can see that's kind of reasonably lower or noticeably lower than the matched comparison group, but both of these groups are well lower than the general population, and that's consistent with basically we were matching according to substantial measures of kind of disadvantage, disengagement, trauma, that sort of thing, disruption. Especially when you look at kind of justice system interactions, I suppose, or experiences, there are really major differences, both between the matched comparison group and the rest of the population, but also especially between ALTED participants and the matched comparison group. So this, for example, is looking at what proportion are currently receiving or currently undertaking a custodial sentence at this particular age. So it's a kind of decent chunk. And in fact, when we looked at 22 different outcomes across 4 kind of domains of outcome, I suppose, and in almost all of those cases, for almost all of the ages we looked at, we found that the ALTED participants had statistically significantly, but also kind of quite meaningfully worse outcomes than the comparison group, and certainly much worse outcomes than the rest of the population. And so as I kind of flagged earlier, we were a bit wishy-washy as to whether, so if you agree that like, or sorry, if your position is that we did a good job matching these people, then this is potentially telling us about potentially causal effects of alternative education, which is kind of a bit concerning. But as I mentioned, there are also kind of good reasons to think that maybe our comparison group isn't quite as disadvantaged, or it's kind of not quite. There are differences there, I suppose. And so the way we ended up kind of interpreting this is that ALTED is a missed opportunity. Is that and so some of these estimates on this slide, for example, are kind of using the logic where, if I go back a couple of slides, if we could provide appropriate support, if ALTED and or additional supports provided appropriate support that met all of the needs of these learners, if we could at least raise the outcomes of the blue line to just this gray line, what would we achieve? And that's kind of what this other slide is getting at. That if we can, that we're missing an opportunity here. And so I suppose part of the thing to emphasize here is especially the other arm of the ERO evaluation, which kind of looked at all the barriers for, for example, I would be really keen to emphasize that this isn't necessarily the fault of alternative education providers. In fact, alternative education is funded at a lower level of resources than mainstream schooling. So it's like you're taking the people who have the most disrupted experiences and kind of the highest levels of need, and you're giving them actually less resources than the general population. And so the question is then, what can not only the education system do, but the broader social sector do to better support the needs of these students? And I suppose that's what that first bullet point is saying in terms of the kind of key takeaways we feel like there. And more specifically, we think that there are a couple of opportunities here. One is within the education system, is that given the finding that the kind of number one pathway or number one predictor of receiving or going into alternative education was exclusionary discipline, there's maybe some additional work that could be done on investigating how can the education system appropriately manage behavior in a way that doesn't involve exclusionary discipline. And then outside the education system, basically, these people are people that, if as researchers looking at the IDI, we can see these people all the way through their life. Like we kind of, it's like you can kind of almost see what's coming because you see all these interactions with various parts of the social sector. And so the real question to us is basically how. The promise would be, how could we better support these learners earlier in their life with the needs that we know that they have before it gets to a point where it's an ambulance at the bottom of the cliff. And we've kind of got some ideas for the types of groups you might want to focus on there if you were particularly wanting to target supports earlier on. And so that's kind of alt-ed. On the basis of that work, we then kind of pursued a little bit of work on looking at teen parent units, which is a slightly different kind of intervention, although somewhat related in that it's also dealing with kind of barriers to continued school enrollment. So the point of this work was the reason why we became interested in this work was essentially to validate our approach, our kind of matching methodology from the alt-ed work. And so the things we were trying to do are basically those kind of three research questions at the bottom of the slide. We wanted to see, can we take that same approach and apply it to a different intervention? And if so, how long does it take? Secondly, teen parent units are kind of interesting because they have been evaluated using a much more rigorous methodology than the one we're using here. And so, so there was I will get to that, but so there's basically a question there of how close to truth do we get with our method? And then thirdly, can we extend that previous work, and can we say anything new about teen parent units? So that's kind of what we were trying to do here. So as I mentioned, there was this previous work that was done by some researchers at AUT as well as MSD, and looking at teen parent units, exploiting a kind of natural experiment. So they were using, they were broadly exploiting kind of geographic differences. And this was a kind of really careful piece of work. I really enjoyed this paper, and when I was in the education system, this is the paper that I would point to kind of say, we can do kind of causal inference and evaluation in the education system well. Like, it's possible because these guys have done it already. And so basically for our purposes here, we're kind of considering the results of that study as being truth. And we're kind of seeing how far does our method, how close does our method get to that truth. So that's just saying, broadly speaking, down here is like RCTs, up here is just doing some kind of comparisons. their method was a bit more rigorous than our method. And what we found was basically, it was pretty easy to apply our method to TPU. So it actually took like no time at all to do this. And then B, what we found was consistent with the previous evaluation, evidence that teen parent units substantially increase enrollment in school and substantially increase NCA attainment for the mothers who take part in them. And basically our results were pretty similar to their results. So it's kind of qualitatively similar. You would have come to the same conclusion, broadly speaking, in a world where that previous high quality evaluation was not done and you just relied on our method, you would have come to the kind of right conclusion. And so we think that's kind of somewhat interesting. And then in the work that we did, we were able to kind of take that same approach and then also look at what happens to the mothers and what happens to their children later on in life. And so some interesting things we found there. Firstly, that children of teen parent mothers or teen parent unit participants were more likely to attend early childhood education. They were significantly less likely to be placed in care, and they were significantly less likely to receive literacy support when they were at school. So that's kind of, broadly speaking, what we found. I won't go kind of too much into that, but we kind of thought that was interesting and a potential validation of our method to show that this method is not just useful in the particular application we used, but could potentially be applied to many other kind of interventions and potentially be useful for other people working in the IDI. We think I should hesitate. I should kind of emphasize, we don't think, like, we're not even calling this an evaluation necessarily, because it is a kind of once over lightly, what can we do with a minimum level of effort. But we do think that there are kind of three cases for using this sort of method in the IDI. One is adding on some level of outcomes to a kind of process evaluation or a qualitative evaluation, which is kind of how we used it in the ALTED case. Secondly, acting as a bridge between kind of operational data of KPIs, etc., and more formal evaluation. So there's a gray area in between, and maybe this method could kind of fill that gap. And then secondly, as we used it in the teen parent unit case, you could use it to extend on previous evaluations. So you've done an evaluation 5 years ago and you're just interested in what are those people doing now, but you potentially can't afford a whole new evaluation kind of activities. Maybe this is something that could kind of play in that space. And I just wanted to kind of say this is, or I wanted to kind of acknowledge MSD are doing this already across as many of as possible of their kind of employment programs, and you can go on to their website that they've got around the evidence catalog and go and see basically what they find for their programs using a pretty similar method to kind of what we're applying here. So they've also demonstrated that, you know, you can do this at scale, and you can do it with not that many resources. And then secondly, and lastly, I suppose to kind of think about what might that imply as a vision. So one might think, based on what we've done, that we seem to have captured a kind of method and a profile for identifying matched participants for adolescence and disengagement in schooling. MSD have done a profile that is around employment and training for their kind of target populations. So could we do ones for other sorts of populations and then cobble them together so that if anyone wanted to do some sort of aspect of impact in the IDI, it could be done like relatively easily with relatively little effort, which is kind of one of the things that we try to, is basically how do we lower the barrier to reliable, making reliable evidence available to people. And sorry, I've gone on a bit, especially given the delay at the start. So that's it, and that's me, and I'm happy to kind of take questions now, but also if people are interested, hit me up, I suppose.
Thank you very, very much, Andrew. That was really fascinating stuff. Interesting that you basically did a validation of your method against what Rima had done, which looked like it was, looked really, really good. Okay. From Lisa saying, very interesting studies. Thanks, Andrew. I have a policy question. What is the sense of why TPUs seem to be effective, but alt-ed does not seem to be? Are TPUs better resourced, better targeting of program support to students' needs, something else?
Yeah, I think I am less familiar with the kind of more process side of the evaluation of TPUs than I am with alt-ed, but I am aware that there are multiple evaluations that have gone on that have really dug into the kind of success factors of TPUs. The ones that kind of spring to mind in the top of my mind is one. There is explicitly in the design of TPUs a kind of joins between what's going on educationally and what's going on kind of outside of education. So, for example, one of the reasons I suspect why we saw higher ECE participation rates is all TPUs are kind of joint educational support for the parent with a creche for the child, and so it's kind of established that the people being treated, I suppose, aren't just the parents, it's also the children. And so it's kind of baked into the design of the model to think about the needs of that entire kind of unit, I suppose. The second thing is, I think there's a lot more emphasis. So where the stated goal of alternative education is to sufficiently engage people and meet their needs to get them back into mainstream education or further education or training or employment, there's a much more explicit goal, as I understand it, with teen parent units to specifically get them qualifications at school. And so there's a much more a much greater emphasis, as I understand it, in terms of like school learning, as opposed to providing only other sorts of support. So my understanding is alternative education providers don't necessarily have to teach to the curriculum. And so whereas teen parent units are explicitly doing that because their main goal is to improve the kind of educational outcomes or qualifications of the participants. So those would be the few things that I would kind of point to, but there are a huge number of both of these programs have been evaluated using kind of mixed methods kind of process type evaluations that talk about the kind of success factors and the barriers. I think there is a difference in funding too. Yeah.
Thank you very much. There's another question from Lisa, but maybe I might jump in there, especially since you said there were evaluations done that were mixed methods. I'm just wondering if what do the students think? Do the teen parents want to be there and the alternative education students not? Would be the first thing I would go to.
Yes, I mean, I suppose that is one of the crucial things, is that conceptually you would think that there is a motivational difference there, in the sense that alternative education is explicitly for the people who don't want to be at school and they have disengaged from school. However, in terms of their motivation, like consistently, not only the most recent ERO evaluation, but prior ERO evaluations and other work that has been done on alternative education, it seems that when people ask participants, do you enjoy, do you like coming to alternative education? Do you enjoy the learning? Do you like your tutors? Do you enjoy the content? Do you feel like it's useful to you? The resounding answer is yes, 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 yes. And in fact, the kind of perspectives that you get from not only the students themselves, but their whānau seems to be that actually it's doing a really good job with that kind of motivation, like turning that motivation around. and I suppose so the thing I would emphasize there is from policy perspective, I suppose that there are really, really big bright spots to the work that alternative education providers are doing. And I suppose the thing that I kind of took away from particularly the ERO evaluation is just that there are also barriers to the current model of provision that mean that providers can't necessarily do everything possible to support learning and well-being for their learners. So they're doing a really good job with that kind of attitudinal motivational thing, but they're struggling to meet all of the needs that the learners have.
Okay, thank you. I'll jump around a bit here because there's a response to the response here from Kathleen from the Office of the Children's Commission, who listened to TPU and alt-ed attendees, and their mothers loved their TPU whānau, whereas the alt-ed had mixed experiences, more disadvantage and feelings of exclusion. So it sounds like there may be a few motivational other differences there that might explain something.
Yeah, I should emphasize they're quite different kind of quite different things, and that might also predict slightly different selection effects into these sorts of interventions too. Yeah.
Okay, another question, I think from Thomas. Do you think there is enough supply side variation in AE for an alternative empirical approach as a robustness check or further research, e.g. the distance to providers that you mentioned, the 9i thing versus the Masterton thing?
Yeah, I mean, that's certainly the kind of REMA's evaluation, the AUT evaluation that I mentioned, was basically built around exploiting that variation, and which is why if you were to use any particular study to think about what are the benefits of teen parent units, I would point you to that study rather than the work that we've done. We've simply kind of replicated that work using a slightly more dodgy methodology, I suppose. So the thing we were trying to do there isn't necessarily, we were explicitly setting out not necessarily to get the best possible estimate of impact. The thing we were trying to do is saying, if we take this conceptually flawed methodology and apply it to this thing, do we get results that kind of look like as if we had have spent a lot of time getting the best possible impact estimate? And the surprising thing to us was actually there wasn't much difference between the two. So that might imply, it could just be that we got lucky in that case, but it might also imply that one of the values of the IDI is that you've got so much information about people's lives, or at least some subsets of people's lives, that you can kind of address concerns around omitted variable bias and kind of selection bias by being able to bring in lots of things that traditionally we would be worried about being unobserved.
Because I guess I'm thinking, I wonder if there are, yes, there are a lot of variables in the IDI, but I just wonder, and it may be different for the teen parent case than for the alternative education case, whether there is just something different about those alternative education children compared to the matched controls. I mean, and also your comparison is really as well, what if we didn't put them in alternative education, how would they end up? So if they're disengaged, maybe they shouldn't be in a school at all and doing whatever they would be spending their day doing.
Yeah. I suppose the two thoughts I have around that is, like, one specifically, you know, we heard a lot from schools that there are massive capacity constraints and that schools have long waiting lists. And so I suppose my argument would be that many of those people might potentially make their way in. So we can't observe waiting lists, and so we don't know that this is the case, but conceptually, many of those people might end up in our comparison group. And so they're actually, you know, whatever they're doing, if not alt-ed, is actually happening there. And then secondly, I suppose there's something in there that we're kind of thinking, what is the value of this information relative to very little information? So the other thing that it was kind of motivated us to do this work is alternative education has been evaluated multiple times over the last couple of decades, but none of those evaluations have looked at what are the actual outcomes of these learners, you know, 1, 2, 5, 10 years on from leaving alternative education, which to me is like a really crucial question. And so even if you just think that our kind of our comparison group is total garbage and that comparison is just not valid, I guess I would point you to just looking in the abstract, the outcomes that participants realize, I suppose, after they leave Alt Ed. I think that's a challenge to the social sector. You know, we ought to be doing better for these kids. And to me, there is value in being able to kind of show that, or for the IDI to be able to show us that picture, to be able to at least say something about that, even if we don't get to, okay, this is a really credible estimate of causality.
Yeah, no, excellent. Thank you very much for that. Something from Andrea in the chat. Okay.
Yeah, she's asking about whether a new model is needed. So I suppose watch the space in terms of, we're working with the Ministry of Education about, and EROR2, about what the implications of this work mean for how alternative education, how it could be improved, but also more broadly, like how, for example, these learners could be better supported before they get to alternative education. So that work is kind of happening at the moment, and we're kind of feeding into that. So watch that space.
Excellent. Thank you very much.